Okay, our presentation is over adult HIV, and this is by Taylor Riggett, Sam Rotz, Taylor Knox, and Megan Gray. So starting with the nature, extent, and scope of the problem with HIV, just some overview. HIV stands for Human Immunodeficiency Virus. It's a virus that can possibly lead to the acquired immunodeficiency syndrome, or AIDS, if it's not treated properly. Even when it is treated properly, the body cannot rid itself of HIV completely. It can be controlled with the treatment, but it's not cured. HIV attacks the body's immune system, specifically the CD4 cells or the T cells. These help the immune system fight off infections. If it's not treated properly, it can turn one's already weak immune system into the last stage of the HIV infection, which is AIDS. The first case of HIV was documented in 1959 in the Democratic Republic. HIV spread rapidly throughout the world. By the 1980s, HIV had spread to 5 continents. These include North America, South America, Africa, Europe, and Australia. Soon after that, the cause of HIV was found. Only a person infected with HIV can transmit through certain bodily fluids, and those include the blood, rectal fluids, vaginal fluids, semen, and breast milk.
Okay, the natural life or history of the disease and condition. The contributing factors are the modes of transportation. Sexually, it's through anal, oral, and vaginal secretions. Bloodborne can be through drug usage and sharing dirty needles. Mother to baby via the placenta or breast milk. Sexual orientation and preference has something to do with it as well. It's mainly from male to male contact, and this makes up 70% of the known cases of HIV. Race also plays a role. The cases are more common in African Americans. Age, 92% of the reported new cases are from homosexual men ages 13 to 24. And urban living, the more people in an area, the more dense the population, the more chance of having HIV. So the pre-pathogenesis period is known as stage 1 of HIV. This is when the exposure first occurs. During this stage, it's very common for it to, or not uncommon for it to be asymptomatic, but you are extremely contagious. At this stage, it usually occurs within the first 2 to 4 weeks after the initial encounter. Again, signs and symptoms are asymptomatic, or they'll resemble the flu: fever, chills, aches, sore throat, swelling of the lymph nodes, rashes, night sweats, and general fatigue. After the initial encounter, you can have a false negative test result, so we'll say that you don't have it when you really do. The pathogenesis period is known as the stage 2 of HIV, referred to as asymptomatic HIV or chronic HIV. This phase would be when the client would already have tested positive for the infection, and during this phase it is essential for the patients to start their medication. Patients who use medications regularly in stage 2 can be in stage 2 for decades. But once the CD4 cells get lower than 200, the person now enters stage 3, which is AIDS. And the populations at risk are African Americans, homosexual individuals, and especially men, ages 13 to 24, and the warmer climate areas with more dense populations. The new cases were 44% African Americans, 24% white, and 13% Hispanic. 67% make up male-to-male sexual contact, and then ages 13 to 24 account for 22% of the new cases, and 45% are in southern states.
Okay, so for determinants influencing the condition, we focused on 3 high-risk groups for HIV. So the first would be gay and bisexual men. Out of all the high-risk groups, HIV hit hardest with this group in the United States. In 2014, they accounted for 83% of the estimated new HIV diagnoses among males 13 and older, and 67% of the total estimated new HIV diagnoses in the United States. The most common cause for this would be sexual relations with an HIV positive person without the correct use of condoms. And as far as race goes, African Americans are higher risk than any other race. This can be because of the higher rate of having other STDs in African Americans compared to other races. The biggest reason for this is a lack of education due to a high poverty rate. And some issues associated with poverty could include like limited access to high quality healthcare, housing, and HIV prevention education. The third high-risk group would be drug users. Fortunately, that the use of drug use due to HIV has declined over the years, but it still remains a pretty serious risk. In 2010, 8% of the 47,500 new diagnoses were from injection drug use, and the cause of this would be sharing needles that are non-sterilized with an HIV-positive person.
Okay, for the distribution patterns, we focused on 3 specific points. First would be the person. Anyone can contract HIV, but there are certain risk factors that can make some people more susceptible to contracting the virus. The place, HIV is not just a problem within the United States, it occurs all around the world. As said before, with African Americans, they make up the highest percentage group affected by HIV, with Native Americans being the smallest percentage affected by HIV. It's found that Asians have had an increasing percentage of people affected, and then Latinos and Hispanics, their rate has just kind of been fluctuating. It's been high some years, low some years. And then for the time in the 1900s, the virus made its way around the world, starting in Africa, and then it was believed to reach the United States somewhere around 1970. And then just a fun fact, according to a study done by the CDC, it is believed that the HIV virus came from chimpanzees transmitted to humans many years ago.
For the condition frequencies, the prevalence of HIV at the end of 2013, an estimated of 933,941 people in the United States were living with the diagnosed HIV infection. The estimated prevalence rate of the diagnosed HIV infection was 295.1. Again, the largest percentage of prevalence of diagnosed HIV was among the African Americans at 43%. At the end of 2013, a total of around 700,000 males aging 13 years and older had 70% of the infections were attributed to male-to-male sexual contact. The prevalence rates were 343.6 in the South, 420.5 in the Northeast, 165.3 in the Midwest, and 241.2 in the West. And that was also at the end of 2013. The incidence rates of the HIV infection has remained stable in the recent years. There are about 50,000 new HIV infections per year. Within the overall estimate, some groups are more affected, as we have already discussed. Some other biostatistical measurements. The monthly HIV treatment regimens range from $2,000 to $5,000 per person. A majority of this money goes towards paying for the ART drugs. Around half of the people that are diagnosed with HIV in the U.S., they don't receive regular health care. 42% receive Medicaid, and the others are just uninsured. Of those people that are uninsured, they can qualify for other health services, and one of those is including the AIDS Drug Assistance Program.
Okay, so for the formation of hypothesis and nursing diagnosis, basically it can be with anything, but we use the drug use for it because of the increase in heroin. If the United States continues in the direction that they are headed from 2005 to 2015, we will continue to decrease the amount of positive cases. The annual amount of reported case dropped by 19% during these years. So if HIV due to drug use is increasing, then the HIV cases would increase. But if you provide education for the susceptible, in this case it would be the drug users, it would decrease, and the HIV cases would decrease as well.
Okay, so the plan for control is divided up into 3 different levels of prevention. So for primary prevention, which just the goal of that is to prevent a disease before it even occurs. The main focus on this would be to provide education. So you would want to educate on safe sex practices, if to not share needles if that is what they choose to do, and then use formula rather than breast milk if the mother has HIV and has a baby. For secondary prevention, which just aims to decrease the impact of a disease once it's already occurred, this is mainly done through screening. So stuff that we could probably do more as a country is to make HIV testing like a routine part of healthcare. We could also start providing it as a prenatal care testing, and we can start building facilities in traditional healthcare settings like drug and alcohol treatment centers or community-based organizations. And then for tertiary prevention, which is used when one would want to soften the impact of an ongoing illness that has lasting effects, you would want to focus on HIV therapy, which would include medications and counseling.
Okay, for the implementation of the control plan, the overall goal would be to decrease the number of newly diagnosed HIV cases, and then also to prevent those with HIV from spreading the infection. Continuing on the last slide, we want to get the public involved because it's important that people know about the disease, and then that could in turn potentially help decrease the spread of HIV. It's also important to get private and official agencies involved. There are 3 main organizations, which is the HIV/AIDS Strategy, the World Health Organization, and the Center for Disease Control and Prevention. Those 3 groups work very closely with each other to come up with control plans. Some barriers for a control plan would be the lack of health care and treatment for those who can't really afford medications, testing. So another barrier would be the budget, because there's not a very big budget, which in turn creates a limited amount of free health care for groups of people.
So for the evaluation of the control plan, HIV is still an ongoing problem, but it can be decreased by making healthcare affordable for those that cannot get the treatment that they need. And the new cases of HIV can be decreased by obviously committing to the control plan and getting communities involved to educate people on HIV and the transmission of it. This will prevent the spread from the source itself. It is important for communities and the organizations listed above to emphasize the preventative measures to help decrease the rate of the newly diagnosed HIV cases.
Okay, so for appropriate reports, in 2014, there were about 45,000 new cases of HIV, new diagnoses. If education can prevent a few less cases in 2016 and in the future, we are doing our jobs. And the awareness is absolutely the key. The biggest thing is just, again, education. And we just need to make sure we teach them the modes of transportation, the risk factors, and how to protect yourself against HIV. And we could do this by implementing signage in public places like schools, hospitals, and doctors' offices, and even a couple of the appropriate local businesses.
Okay, for our research recommendations, overall, the best way to prevent the spread of HIV is to provide more resources for the individuals affected. Engaging in safe and protected sex, as well as not sharing needles and staying away from drug use, are both ways to help the world overall prevent the spread of HIV. Educating and getting more people involved about HIV is also another way to help stop the HIV epidemic that this nation and world are experiencing today. So by educating individuals to remain knowledgeable about the disease, healthcare will overall see a decrease in the disease.